For some unapparent reason, I shut my left eye and the little red light that tells you it's in standby disappeared. So then I realised that the TV frame was no longer square if I shut my left eye. As soon as you spot that you've got a problem, get an opticians to check it over, because they're the people that will refer you to the hospital to have any tests and any follow-up for it.
Age-related macular degeneration is called AMD for short. WET is characterised by abnormal blood vessels growing in the retina. Typical symptoms are a wiggly line, distortion, or blurring or a deterioration in the vision. When you go to your optometrist, they may notice some changes at the back of the eye which indicate that there's a problem. If there's any sign of blood vessels growing, as you see in wet AMD, then they will refer in for treatment.
Wet AMD is treated with a medication called anti-VEGF, and this medication is given via injection into the eye itself. And the way it works is that it acts on the blood vessels at the back of the eye, the abnormal blood vessels that have grown, to get them to shrink and stop them bleeding and leaking.
So when you come for your first appointment, you need to bring a list of your medication, your reading glasses and your distance glasses. You shouldn't drive because I will apply dilating drops in your eyes and your vision will be blurred for several hours.
Go into the reception and say, just tell them that you've got an appointment and who you are and the other bits and pieces. And they then direct you to where you need to go. It's not quite the same eye test as you would get as the opticians. You're a lot closer. To my mind, what they're trying to do is find a benchmark to start from.
Then I will check pressure in your eyes. After I check pressure, if the pressures are in a normal healthy range, I will apply dilating drops in your eyes.
They put drops in to expand the iris, I think it is, so that they can see as much as they possibly can at the back of the eye.
First drops that I use is called phenylephrine. It doesn't sting. But second drops that we apply in the eye is called tropicamide and it stings. After dilating drops, I take you for the next waiting area where you'll be waiting for the images, because we need to wait about roughly 15 minutes for drops to dilate your pupils and then to be able to have images of the back of your eyes.
And our imaging is usually a colour photograph of the back of the eye, or something that you may hear the word optical coherence tomography imaging, OCT for short, which is a type of imaging process which looks at the layers of the retina in great detail and helps the clinician make a decision as to whether there is age-related macular degeneration there or not.
Sometimes the OCT scan isn't enough to make the diagnosis and we need to do some additional tests called fluorescein or ICG angiography, which is another method still to try and diagnose your AMD.
You'll then have all your imaging reviewed, you'll be asked some questions about your vision. We'll take a history about your general health and look at your medication list, and then we will decide whether or what your diagnosis is.
So for the very first appointment that you have, it can take up to 2 hours because you'll need to have your visual acuities done, you need to have the imaging done, and then you need the interaction with the clinician, and then also after that, if it is possible and if it's appropriate and you do require it, then the injection may also be done on the same day.
We would discuss your treatment options and how that plan of treatment would progress at your first diagnosis appointment.
The aim of treatment is to try and stabilise your vision, stop the vision getting worse, or potentially even in some patients make it a little bit better. Most injections are very well tolerated, but there are risks with any procedure. The main risk really is a 1 in 2,000 risk of infection, which can be potentially serious. There are some less common risks, which we also have to warn you of, and we would give you all the information you need on what to look out for and when to come back if you developed any of those symptoms.
Everything's explained and you sign consent form to have the injections. They give you a copy, so if you need to reiterate in your own mind what was said and what you've actually consented for, you can read all the documents again.
We'll prescribe an initial course of injections. That's usually 3 or 4 injections spaced every 4 weeks, so about a month apart. And we'll see you in clinic on the day of the last injection and check your vision, do scans of the back of the eye and see how your eye's responding. And the aim really is to try and gradually increase the gaps between the injections, so to try and keep things under control, but making the injections further and further apart. Most people will probably need treatment for at least 2 years from the start. Some patients may need a lot more, so we really tailor that approach depending on your treatment response.
Receiving a diagnosis of an eye condition can be very traumatic for some people, it can be very upsetting. We will try our best to explain the condition in ways that so you can understand it as clearly as possible, as well as what the treatment options will mean. And we can also point you towards sources of support and extra information and help if needed.
The frightening thing, the thing that really worried me was, am I going to go blind? That's the scary bit. I could sit in a corner and cry. It was that much of a bombshell.
Diagnosis of any eye condition doesn't just affect the patient, it affects their family, their close family members and close friends as well. So it's quite nice to be able to have that dialogue for everybody and get everybody involved, of close family and close friends if possible.
The family support is the main one, external. If I need it, if I really do need it, I'll look to it. I think it's here. This is where you've got to deal with it all. And it's like a lot of things, if you dwell on it too long, it can be overwhelming, and I try not to.
Before we do anything, we need to check who you are by asking for your name, your date of birth, and the full address where you live. And also we check from the prescription which eye to be injected and the type of medication to be injected. And if you have any allergies, we need to work our way around that. We advise not to wear makeup or foundation on the day because this can increase the risk of infection.
They get you comfortable, a couple of cushions under your back, and you also wear one of these nets to keep your hair out of your face. So, you know, there's nothing actually going to get in your eye because of that.
They'd put some drops in to anaesthetise your eye, to numb your eye, and also some antiseptic drops to clean around the eye. And then they would go, the nurse and the injector would go through a series of checks to make sure everything's in order.
The nurses will be either prepping your eye, sterilising it, and putting the anaesthetic in the eye. The second nurse would normally be taking information from you and putting it into the system. The anaesthetic, they put a couple of dots in your eye to start with because it does sting to start with. It's quite uncomfortable. They wait a couple of minutes, a minute or two, for that to take effect and then put some more in.
We distract you by asking you to look in a particular direction. And we tell patients at the point of entry of the needle that patient is likely to feel a gentle pressure or a slight irritation, discomfort in the eye.
You may feel pressure as the needle goes into your eye. You won't see it coming because we give the injection from the side, and literally it only takes a few seconds, so it is over often before you know it.
If you imagine pushing on your leg with your finger, it's that sort of discomfort. It's nothing more than that. To be honest, you don't really realise that it's been done.
And then the nurses will wash out the antiseptic and then sit you up, and then you'll be all done with the procedure.
If everything is fine, most people go home straight away. If they feel giddy or they feel unsteady on their feet, we ask them to wait a little bit.
The after effects vary from person to person. It's a bit like having something in your eye, a speck of dirt, and it always seems to be on that side of your eye, and it makes my eyes water. Most of the injections I've had have been in the morning, and it's been uncomfortable all that day and best part of the following morning.
After injection, sometimes people have air bubbles or floaters. Whether that's normal, it will resolve after a few days, not to be worried about. Definitely no water in your eye for 48 hours. We also make sure that we tell patients that if there's a problem, they have to call us straight away. And we ask them to watch for any sudden loss of sight or reduced vision or any intense pain in the eye. We give them the eye hospital number to call.
The follow-ups tend to be, I think it's after the third injection. At that point in time, They tend to make a decision as to whether they're going to continue every 4 weeks or extend.
Well, it's important even between your visits to the clinic that you continue to monitor each eye individually for any changes in the vision, because if there are any changes, we need to be notified about it as soon as possible and we can try and bring you in sooner.
Don't underestimate how it might affect you, and don't be too concerned about feeling that it has affected you quite so badly. No question is too silly. We want to hear that question from you. Give us a call, come in and see us, and we can talk through all of it with you.
And there are also many other sources of support, such as our eye clinic liaison officer, local charities such as My Vision Oxfordshire, or other national charities that can support you in terms of dealing with the diagnosis and coping with those aspects of the disease.
It's very important not to smoke. It's very important to eat a good diet, rich in highly coloured vegetables, and if possible, if you're not vegetarian, a little bit of oily fish, and also to have good blood pressure control and generally keep fit and well.
Age-related macular degeneration is a very common disorder, and even though it can be very daunting and intimidating at the start of your treatment, it is something we see and manage very frequently. It is something that we do as a routine procedure day in, day out, every day of the week, and is something that the team will be able to reassure you about and hopefully help you through in a relatively straightforward way.
Eyes are precious. Please come for your appointments. Don't miss your appointment. Many patients that had benefits from having treatment for AMD.
Do not hesitate. If you are told you are suffering with AMD, go and get it treated. The people that are there doing the injections are very good at what they do.